everybody. I wanted to bring this call to you today because there's so much going on in the world, so much sickness, so many different ailments out there. We call it dis-ease, where the body is out of balance, it's out of its homeostasis. We're getting hit with things environmentally. It could come from anything, deficiencies in food, things that are being, added to the water that we're drinking that maybe aren't necessarily filtered out. Whatever it is, there is a lot of sickness going on in the world right now. And most of you know I'm a doctor of naturopathy. I went to school through Trinity School of Natural Health. And since then, I have studied with numerous kinds of doctors. I've not hidden any of that. I always put everything out there in the open. And I get referrals from people all the time that know that I'm out here and that I'm working with people and doing my best to give them hope and to kind of lay out a game plan. We look at what people are eating, we look at what they're drinking, we look at sleep habits, and we try to just get things more in balance. And this is not alternative remedies. This is what has been around for thousands of years. People didn't have the modern day medicine as we know it, and they had to do the things that I specialize in, which is back to our roots, back to the plants, back to the healthy things, back to the nutrition and supplementation and lifestyle changes. So we have a guest on today. I am, for the protection of the parties, not going to state their names. We're not going to state exactly what they did, but I do want to lay out for you that she came to me by referral in the month of December 2018. And I received a phone call from her, and she said, and it was kind of gut-wrenching, the tone of her voice when she called me. And sometimes I can't take a call because I'm so busy with other people. And if I have things lined up on the calendar or people on the other line, when I receive a phone call like I received from her, I will clear the line out, and I will not leave that person until we get to what it is that they're calling me about. And she called me, and she stated some very specific words, which were, "Randi, please help me save my son." And with that, I stayed on the line with her, cleared out my other line, and we got to talking, and we got a little bit of history of what her son was going through and his age range, which he is in his 40s, and he had been battling for a long time. So if you would, go ahead and give us a little bit of history about your son.
My son had cancer the first time when he was 20 months old, and it was a Wilms tumor, and that is a tumor that is more prevalent in adolescents than adults. He did have the tumor removed, the kidney also removed, and had chemotherapy and radiation. And after that, several years, had scoliosis, so we dealt with that because the kidney and the muscles around that, on that side, were removed, and we were told that that was probably going to be inevitable. So we dealt with that. And in the fall of 2017, actually a couple of months before that, John started getting some pains in the stomach, and also his blood sugar count went, and he's not diabetic, went crazy. It took a long time, it seemed, to find out what was wrong, and the diagnosis came out in October of 2017 that he had pancreatic cancer. The doctor believes in doing chemotherapy and radiation before surgery, and that's what happened. He went through all of that, and then on June 29th of 2018, he had he had a surgery, an 11-hour surgery, called a Whipple procedure. The doctor we have is one of the best in the world, actually, and he could not remove the pancreas because of John's earlier cancer. All of the organs had moved counterclockwise, and the scar tissue was like concrete. and he just couldn't get to it. So it isn't the news that we wanted, and we were, trying to deal with this. And so that's what brought me to this December phone call.
Yes.
So that's the background.
Okay, very good. So basically what we did is we went over his lifestyle. We went over what was going on with him. You told me the history. You told me different things that he had been through these procedures, and he was really in bad shape, really bad shape. How bad was it?
Well, when you're 49 years old, when you're 49 years old and you're told that you have terminal cancer and you have 4 little children, the mental anxiety, the depression, he has had all the radiation that he possibly can ever have in his life. So radiation is no longer on the table. And they think that this is actually what brought on this pancreatic cancer. When he was little, and I say that was many years ago, technology is not like it is today. And the radiation that he was given for that cancer, the Wilms tumor, was, let's say, like a gunshot. Compared to nowadays, it's like a sniper bullet. Extremely precise. So what the doctors are feeling is that he was over-radiated. Too large an area, and the pancreas is right there, right smack dab next to where his original cancer was when he was 20 months old. And they feel that is what has brought the cancer on at the age of 49.
Okay. So
we didn't know what else to do. The chemotherapy he went through was they were doing the strongest they could. They had 5 different things mixed together, and he was a zombie, an absolute zombie. He didn't know. He could hardly function. He couldn't drive a car. He just couldn't. So as a parent, what else is out there? And so I started reading up and checking on things and decided that we needed to, take it a step further. So that's what we did.
And you reached out and you started to gather your options, which was good. And so moving forward, there was another phone call. We implemented some things. We were very aggressive about it. We did not hold back on anything. As a naturopath, I do not treat, diagnose, or cure. I'd never state any of those things. What we do is we give hope, and we load the body up with so many nutrients that you're giving it the ammo to go into the fight, and to we've got to strengthen and support the body's immune system. So those are the focuses. So we get rid of any bad and we put in any good, and it's always totally up to the client or the family members. Nobody is holding anybody to it. We're not saying you have to do this. It is completely optional, and if you do it, you have some better odds of survival, because this is what the body is screaming for to begin with. So, we were 30 days into this, and I get another phone call from you, and you said he is doing better. It's gone back some. They've had some tests, and it had regressed, but you said everything is looking better, and we have hope now, but he isn't putting on any weight. And so we tweaked a few things. I threw out a couple of ideas and options for you. And I think you and I touched base within about 24 to 48 hours of that. And you said, my gosh, he did this. And all of a sudden he had this incredible appetite. You remember that phone call?
Yeah. And he does, he is sporadic with the appetite. There, as with all of us.
Mm-hmm.
There are some days that he is extremely hungry, and other days he's just normal, and then some days, he's just, not that hungry. But in any event, that has definitely improved because, part of the problem, of course, is you have to realize that in the surgery, a third of his stomach was removed. They completely redirected his digestive system, and that all takes time.
It does take
your
time.
Body to acclimate itself, to this new situation. And his system is still working on that. The main thing that we are always concerned about is metastasizing.
Mm-hmm.
And so it wasn't until, I want to say, maybe 2 months ago that they did a complete scan like they did just before the surgery, which was the end of June of 2018. So that was quite a long time, and we were extremely anxious.
Okay.
Wondering what the results were going to be. I mean, to the point of, hyperventilating almost. Anyway, so when the radiologist came in and said there is no metastasizing, and I'm sorry, it was the oncologist who came in and said there's no metastasizing, and the 2 tumors that are in the pancreas have not grown. I mean, we went crazy. We were so elated. And the oncologist said, whatever you are doing, just keep doing it. Now, last week, we went in for another set of scans. And again, the next day we were told exactly the same news, that he there is no metastasizing anywhere, that the tumors in the pancreas have not grown. And after the doctor walked out, his physician's assistant looked at us and said, I really, really want you to understand what we're saying, that by now, and she took her hand and sort of moved it, in front of her own abdomen, saying, by now, most people would have lots of other things happening, meaning, metastasizing. She said, this is very unusual, and, we're extremely delighted where we are right now. So that's exactly, right now, between the medicine or the supplements, that I prepare for him, which I do in little snack bags, and I mark them Monday to 7 days a week, and I do 3 a day, 1, 2, and 3 for Monday, Tuesday, Wednesday, and so on. And I divide up the pills because no one can consume all of those supplements, in one fell swoop. So we work it out this way, and I keep track. It's quite easy to do that, and it's we are still every day, and every time we go in for these scans, we are always going to be holding our breath. And pancreatic cancer is a very bad type of cancer to have, and none of it is good, but it's extremely difficult, and the cure rate is just not there, like with colon cancer and some others. But, I'm just hopeful, and, we're walking the walk. So that's it.
Can you mention some of the different types of tests that you have been doing with, or that he has had done over the last, at 30 days he was doing something. At 75 days, I got another phone call
I'm telling you exactly how it is. It's just that there is no metastasizing, and the tumors in the pancreas have not grown. And by now, they really should have, and they have not. He still, it's hard, but he was having a thyroid problem, and your thyroid should be like 0.5 to 4.5, and his was 79.
Okay.
They didn't know how he was functioning, to be able to get on a plane or do anything. And so now they've given him thyroid, medication, and that has changed within 2 weeks, and he came down to a 6. But, so we're working on that.
What other improvements have you seen? And name the tests, if you can, the different types of tests that he's had and what some of the results were since we have started this.
Right.
Okay.
Yeah. He has had 3 different bouts with an abscess on his liver, and twice a drain had to be put in and, kept in for several weeks, and also infused. I would infuse him 3 times a day with antibiotics, and so we just finished that up again about a week or so ago. That's been the only the main problem that he's had that has set him back, and that is also quite common because of, again, the digestive system that was completely rerouted. So but he's doing quite well, and the doctors are pleased, and we take it, one day at a time.
Okay.
But the only thing, he's not interested in any more chemotherapy. He's not going to do that. His body cannot have any more radiation, and I'm just, very, very pleased as to where he is right now. So every day, we're working on a little something, adding a little whatever, extra, walk or some yoga and, that type of thing to complement all the supplements that he's taking. But it's that no metastasizing, no growth is just like you've won the biggest lottery in the whole world.
That's incredible.
That's it, and that's it's very seldom used in pancreatic cancer, but I am continuing with the program and being hopeful because, as the oncologist said, whatever you're doing, just keep doing it.
Perfect.
What more can I say? That's it.
That's it. Every day with him is a gift. And I'm sure for him, every day with you is a gift. And I'm just happy that we could jump in there and help. And hopefully this interview here will give people hope.
I hope so, because it is such an important part of whatever type of cancer someone is facing. And I've spoken to so many different health people, at the professionals at the hospital, and they say it is so important to have the correct attitude. So when you're taking these supplements and then you get these kinds of reports in our situation, which are just, lift your spirits. So you just, one never knows, and everyone's cancer is different. Everyone reacts differently, but so far our situation has been extremely positive, and if this will help even one other person out there, I will be extremely happy. So.
Well, you've definitely done your part, and thank you for intervening on your son's side. And cannot tell you how much I appreciate you being willing to come on here and speak about it, and we will continue to track the progress.
All right. Thank you so much.
Your body's ability to heal is greater than anyone has ever permitted you to believe. And a healer is just someone you go to for healing, and they help you to find the keys within you for your own ability to heal. And that's the best kept secret of medicine, is that the body heals itself if we create the right conditions and stop doing the things that cause the sickness in the first place. And the sign of a really good doctor is not how many patients he can put on medications, but how many he can get off of the medications. If you know someone who needs our help, please send them over to TheBodyCan.com/schedule. And we'll get you in the calendar, and we'll have an incredible conversation. We not only do preventative care, but if you're already afflicted with something, then we address it that way. So please come out and see us. Thank you for listening. These statements have not been evaluated by the Food and Drug Administration. Statements are not intended to diagnose, treat, cure, or prevent any disease or ailment. TheBodyCan assumes no responsibility for the improper use of any products or protocols. We recommend consulting with a qualified health professional when preparing a treatment plan for any and all diseases or ailments. TheBodyCan does not make any health claims about any products and recommends consulting with a qualified health professional prior to consuming any products or preparing a treatment plan. It is especially important for those who are pregnant, nursing, or chronically ill, elderly, or under the age of 18 to discuss the use of any products or protocols with a health professional prior to proceeding forward. The information on our website is intended to provide general information regarding our products or services and is not intended to be construed as medical advice or instruction. Doctor of Naturopathy, Randi Shannon, has studied natural remedies since her early 20s and received her education through the Trinity School of Natural Health. She has since studied with emergency room, medical doctors, acupuncturists, naturopaths, veterinary medicine, holistic chefs, professors of natural medicine, and more. Randi has been closely associated with and consulted for many well-known executives, spiritual leaders, authorities, celebrities, entrepreneurs, and health and wellness companies. Please join Randi on Facebook at facebook.com/groups/TheBodyCan. No spaces. Thank you for listening.